Good morning, everyone, and welcome to the 2019 Adult and Youth Mental Health Survey Report Review webinar. I'm Genevieve Rasmussen, and I'm a project coordinator with Comagine Health. I began coordinating the survey administration partway through the 2019 survey cycle, and I'm currently administrating the 2020 survey. Before we begin, I want to cover a few housekeeping items that will allow the webinar to run smoothly. First off, this webinar is 1 hour long, and the webinar is being recorded. Slides and recordings will be provided after the webinar to registrants. All attendees will remain on mute, and please send questions via chat. We'll have a moderated Q&A at the end of the presentation if there's time. When you go ahead and enter questions into chat, please be sure and change the to option to all panelists and attendees so everybody viewing the webinar can benefit from your questions. Next up, I'd like to pass it on to Rebecca Gould, our Oregon Health Authority person.
Hello, my name is Rebecca Gould. I've been with the Oregon Health Authority for about 8 years, and my work has mostly centered around health insurance coverage surveys for the general statewide population. I joined the mental health survey team in the beginning of 2020. I've really enjoyed this work. There are many great subject matter experts at OHA around mental health services. I've learned a lot from them. So if there's any questions I can't answer that you may have, I can definitely get in touch with those who know. So thank you. It's good to be with you today.
And hello, I'm Sarah Halvik. I'm the Senior Director of Analytic Services at Comagine Health and have been involved in administration, data collection and analysis of this mental health survey for 7 years, the 7 years that I've been at Comagine Health, even though the survey's been running longer than that. So I'm familiar with the process and very excited to talk with you all today about what the survey is, who we collect feedback from, and what the results are showing us. So thanks for having me today.
This is Rebecca again. I'll just share a brief little background on the survey. It's the Mental Health Statistics Improvement Program. This is a survey that we do here in Oregon, and many states around the country do. It's developed by SAMHSA, the Substance Abuse Mental Health Services Administration. I'm sure you know them, which is within the U.S. Department of Health and Human Services. So the survey is developed by SAMHSA and used and customized a little bit by the states. There are several methodologies that the states use, but the questions, the base core questions, are used pretty universally. And OHA uses this data to report for federal grants and funding. It's a requirement of some of the monies that OHA uses for mental health services in the Medicaid population. And then we also collect data to help inform OHA, CCOs, and other partners on Medicaid consumer and member outpatient their behavioral health satisfaction of the services they receive. The surveys cover people who receive services in outpatient, psychiatric, residential, and then also day treatment settings. OHA and Comagine, as Sarah mentioned, have been working together for many years, and the slide there says 12 years on this project, and the slide also details a little bit of the name changes that we've worked with Comagine under. Now we'll have more details on Oregon's methodology, and Sarah will discuss that.
So the surveys themselves, there are 4 different versions of the survey that go to 4 different populations in Oregon. So there is one that is targeted to adults receiving mental health services in outpatient settings, a second one to adults receiving services in residential settings. The Youth Services Survey, or the YSS, is a survey sent to youth aged 14 through 17 who are receiving services in any setting. And the YSS-F survey is the Youth Services Survey for families, the survey that is sent to caregivers. And those can be caregivers of children 0 through 17 who are receiving mental health services in any setting. So all 4 of these surveys include the standard MISIP question set. So those are the validated questions. There's about between 28 and 32 of them, depending on the survey. And then we've added additional questions with OHA about the patient's experience of care. So as there have been different statewide initiatives to improve quality of care or to focus on improvement in one area or another, OHA and CoMagine Health have been able to add questions to get more information about the patient's experience of care in that area. Next slide. So the sample, OHA pulls the sample. There are about 120,000 adults and youth who qualify to be in the sample, which means that they have received 2 or more behavioral health services that were paid by Medicaid in the previous 12 months. Out of that population, that universe of patients, OHA pulls a sample of about 28,000 adults and youth and oversamples non-white populations. Next slide. So the survey is administered August through December annually. There are online and paper survey options. So the way the 3 mailings work is the first mailing goes out as a postcard, and the postcard has a unique login information to the survey recipient with a website. So they receive a postcard with a web address and are prompted to go into that web address and complete the survey online. About a month later, if we have not received a completed survey from that individual, we send them a letter with a reminder to complete the survey that has, again, the link to the website and their unique identifier or unique code to get into that survey, and also a printed paper survey. So they have a printed paper survey they get if they want to complete it on paper, and also a prepaid self-addressed stamped envelope so that they can return it by mail free of charge. About a month later, if we still haven't heard from the recipient, we send them a third letter, very similar to the second. So it's a letter reminding them to complete the survey, as well as a printed copy of the survey itself, along with that self-addressed and stamped envelope. We offer incentives for online completion, so a $10 gift card to either Amazon or Starbucks. The recipient gets to choose where they would like the gift card. And we do this to try to keep the cost of the survey down. You know, if people complete the survey online, there's no data entry required. There's no risk of keystroke error or other error being introduced to the survey. So we try to incentivize online completion, but of course make it equally convenient and possible to respond by paper as well. Another thing on the mailing process, so we work very closely with a mail house in Portland, and the addresses that we use to mail these surveys out come from OHA's data set. But the mail house is also able to run an updated address check. So if there is an updated address on file with the US Post Office, for any of the people receiving a survey, they automatically update that person's address, reducing the chance that we get returned mail with bad addresses. When we do get returned mail with bad addresses, though, we take the individual out of the samples so that we don't keep sending mail to an individual that we don't have a valid address for. Next slide. So the weighting and analysis of the results, once we've collected those and closed the survey, we apply post-stratification weights so that the weighted results are representative of the population receiving behavioral health services that were paid for by Medicaid in Oregon. So, you know, the sample, we pull about 28,000 people, and the weighting ensures that the respondents within that 28,000 are representative of the 120,000 people that were eligible to receive a survey, which means that as we present the results, we've weighted them to be representative of the larger population. We examine frequencies and trends over time and apply statistical tests where appropriate. And we also break out the results according to patient characteristics, so gender, race, and ethnicity, also by coordinated care organization and certified community behavioral health clinics, or CCBHCs. Next slide. So with this survey, as with all surveys, there are some limitations. So the MISIP domain portions, those are the 28 to 32 standardized questions at the beginning of the survey. Those validated questions have remained untouched throughout the whole course of this survey. But like I mentioned earlier, OHA and Comagin Health have also added and removed additional questions over the years. So these are, I think, very important to making sure that we're asking the right questions about the patient's experience of care. But also the limitation of these added questions haven't been validated. We haven't sent them through psychometric testing or any validation process. So we don't know what the effect is, if any, that those added questions have on the validity of the preceding MISIP items, which had been validated. We also know that the length of the survey may deter some potential respondents. Depending on the individual, it can take 10 minutes or it can take 30 minutes to complete the survey. When people receive the printed paper version of the survey, it looks very long. It's multiple pages. The font is intentionally large, which makes the survey look even longer. So we suspect that the length of the survey may deter some potential respondents. And we also recognize that the more time that passes between receiving mental health services and receiving a survey to complete can introduce some recall bias, which may influence the results. That is asking patients to think back 12, 18 months to services they were receiving at that time. Next slide. So Rebecca's going to walk through some of the adult outpatient results now.
Thanks, Sarah. So Sarah and I will alternate discussing the results from the 4 surveys. That I'll start with the adult outpatient survey. This slide just shows the 7 domains that are the core set from the National MISIP survey. You can see their access, daily functioning, general satisfaction, outcomes, participation, quality and appropriateness, and social connectedness. And then we also list some of the additional areas that we collect data in around living situation, employment, and trauma. Next slide. And I would just mention, sorry, I forgot, for details on the specific questions, we'll have a link posted with all of the surveys and all of the results as well. Okay, so this slide just shows some of the demographic breakdown of the respondents of the adult outpatient survey. You can see in the bottom left that in 2019 the response rate was nearing 20% and that 2/3 completed the survey online. As far as the demographics go, we see that a large proportion were white and the second largest group was unknown. That's one challenge we're working on at OHA across all of OHAs to have better race and ethnicity data overall. But we do have good representation compared to the population that receives the services. Ethnicity, again, about 62% not Hispanic and quite a large percent unknown. We do have more female respondents in this group, but there was also a proportion that identified as transgender, so we're getting better representation by gender as well. Age, over 80% of this group were, well, about 80% were older than age 26 and less than 65. And about 63% were in rural areas. All right, next slide, please. Again, here are the 7 domain scores. They're listed in order of the most satisfied. So this measure is a weighted calculation of all of the positive responses. These are Likert scales. So how satisfied were you? Very likely, somewhat, medium, and lower. So it's counting all of the positive responses for all of the questions for all of the people who answered them and creating an overall score. So we can see that for all of the respondents, quality and appropriateness of care, which an example question of that would be staff were sensitive to my cultural or ethnic background. That's one of the questions in that set. That was the highest at 80.8%. And again, this is 2019 data. The lowest were outcomes in the outcomes of the survey and then their daily functioning. And a daily functioning question would be something like, I'm better able to handle things when they go wrong. And the outcomes would be, I deal more effectively with my daily problems. And those were the lowest in 2019. Next slide. This slide, and we'll have a slide like this for each of the 4 surveys. This shows 5-year trend data for the 7 domains. This slide, or for this survey, is the one with the most statistically significant changes of the 5 surveys. So there are 5 of the 7 that have the little asterisk. That asterisk by the label indicates that there was a statistically significant change over the 5 years. And we see that quality and appropriateness and general satisfaction were the highest consistently over the 5 years, and daily function and outcomes were the lowest over the 5 years. However, there were increases for nearly all of these, and all but participation increased from 2018 to 2019, although we don't have the statistical significance specifically for that relationship on this slide. Next slide, please. On this slide, we have a couple key findings from specific questions or topics out of those 7 domains. Again, this is 2019 data. As far as the housing statistics go, just remember that this survey, the fielding completed in late 2019, so this doesn't account for any changes that may have occurred for people because of the COVID-19 pandemic in 2020. It'll be interesting how these rates change after reviewing the results of our 2020 survey. But in 2019, there was more homelessness and more time in correctional institutions, the survey measured. As far as employment though, 14.1% reported that they found a newer, better job, and employment is also increased in the past 5 years. So these are good outcomes in employment, and more areas to work on regarding housing. Next slide, please. And now Sarah will talk about the adult residential survey.
Yeah, just a reminder, so this was the survey that was sent to adults receiving care in residential settings. The response rate was 18.7, and 82% of those respondents completed the survey on paper. You can see the demographic breakout pretty similar to the adult outpatient survey respondents. 60% were white, 94% were not Hispanic, 55% were male, 80% were adults aged 26 to 64, and 65% were in urban areas. So that is a key difference between the residential respondents and the outpatient respondents, is that these residential respondents tend to be more centered in urban areas, where more of the adults receiving outpatient services were in rural areas. Next slide. So here are those domain scores. Again, the percent satisfied are the percent of respondents who indicated that they were satisfied or very satisfied on average 2 questions in each of these domains. So general satisfaction, access, and the quality and appropriateness of care have consistently had the highest levels of satisfaction over the last 5 years. You can see 78.7% of respondents were generally satisfied. 77% of respondents receiving residential care were satisfied with their access to that residential care. On the lower end of the scale, the lowest percent of respondents were satisfied with their participation in their care. Next slide. So here are those 5-year trends. You can see the general satisfaction, access, and quality and appropriateness there at the top is consistently the highest scoring domains. While the curves look like they are curving upward or downward, none of these are statistically significant trends over the last 5 years. So my conclusion on this would be satisfaction levels are holding pretty steady. Next slide. So other interesting results, these are from some of those added questions beyond the domain scores. So looking at housing, we've seen an upward trend, a significant upward trend among those who reported needing housing as a reason for currently being in a residential treatment facility. That's over the last 5 years. And also the need for housing has trended upward since 2015. So similar to results in the adult outpatient population, housing continues to be an area of concern. There were also several questions in the residential survey about care coordination. asking whether the respondents, or how satisfied the respondents were with the coordination of their care between their mental health provider and other providers. We found that satisfaction with coordination with their physical health provider, between their mental health and their physical health provider, was very high. Almost 95% of respondents were satisfied or strongly satisfied with the coordination between their mental health and physical health providers. And 93.5% were satisfied or strongly satisfied with the coordination of care between their mental health provider and state or acute hospitals. So that's great. Those are very high satisfaction scores. We have also seen a downward trend in satisfaction with care coordination with another mental health provider. So coordination between one mental health provider to another, we've seen a significant downward trend in satisfaction in that area in the last 5 years. Next slide, please. Rebecca, back
And
to you.
I'll talk now about, oh, thank you. So this is the Youth Services Survey, and again, this is for youth ages 14 through 17 who received 2 or more Medicaid-funded mental health services in the past year. The domains from the national survey are a little bit different. The key differences here are a section on appropriateness of services, and then also family participation in treatment. We also have some different additional questions about living situation, but school attendance specifically for this age group, and then a few other additional areas. The next slide, please. Here's our demographic slide. Not too surprisingly, almost 80% completed the survey online for the youth, these 14 to 17-year-olds. And the response rate was about 17%, so that is good. Going down the demographic table, we see that a large proportion were Hispanic, which is very good that we're reaching those populations, and about 52% were white. As far as the ethnicity, though, still pretty high, unknown, but getting good representation. And then according to by gender, about 45% female, 39% male, and then 16% identified as transgender. Ages were split pretty evenly between 14 to 15 and 16 to 17-year-olds, and about 60% were in rural areas and 36% in urban. And next slide, please. Here are the weighted domain scores. We see that cultural sensitivity was rated the highest, and that access was the lowest at 64%. Next slide, please. Again, here are the 5-year trends. We see that participation is the only trend line that is statistically significant, most likely due to the big change between 2015 and 2016. And everything else has remained pretty stable over the 5 years, but cultural sensitivity being much higher. And again, this is how the youth are rating their mental health services that they receive. Next slide, please. These are from the additional questions we ask about living situation, key findings from the 2019 survey. So again, this relates to the housing issues and challenges that we saw in the adult surveys, but the survey showed that more youth are living with one or both parents over the past 5 years, and that 82%, 0.8, reported living with one or both parents in 2019. So that number has increased steadily over the past 5 years. And then we found that the number of youth who'd gone to court has increased, or sorry, decreased. It's trended downward since 2015. So that is a good outcome for those receiving mental health services, that it is leading, for some of them, overall, fewer interactions with law enforcement and time in court. So that is good. Next slide, please. And now Sarah will cover our last of the 4 surveys.
Thanks. So the caregiver survey reminder is sent to caregivers of children and youth who are receiving mental health services. All of the youth aged 14 through 17 who receive their own survey, the YSS survey, their caregivers also receive this family version of the survey. So those households receive both surveys. The domains in this family survey include access, appropriateness of services, cultural sensitivity, daily functioning of the youth, the satisfaction with the family's participation in their child's treatment, social connectedness, and treatment outcomes. And then we've also added additional questions about the youth's living situation, school attendance, trauma, and a number of other areas. So here are our respondent characteristics. This is the caregiver completing the survey, but answering these demographic questions about their child. And the response rate was 22.3, which is quite good. About 3/4 completed the survey online. So the children of these caregivers completing the survey, 13% were Hispanic and 58% were white. Looking at ethnicity, again, a high percent of unknown, and about half identified as their child is not Hispanic. Gender breakout, about half identified their child as female, 7% as transgender. Age breakout here was mostly split between the 6 to 12 and 13 to 17-year-old age groups. A small proportion of caregivers were responding for a child who was age 0 to 5. And as we have seen with the urban, urban-rural distribution on the other surveys, about 60% were responding from rural areas. Next slide. So the domain scores here, as we've seen in the other surveys, cultural sensitivity was rated very highly. That means 88.2% of caregivers who were responding to the survey indicated they were satisfied or very satisfied with the cultural sensitivity of the mental health services that their child was receiving. 82.7% were satisfied with the social connectedness of their family. And then you see down at the bottom of the list their outcomes. So 63.8% of caregivers reported being satisfied or very satisfied with their child's outcomes as a result of the treatment that they were receiving. Next slide, please. So over the last 5 years, you can see that cultural sensitivity consistently tops the charts with very high satisfaction. It's actually trended down over the last 5 years. It looks like a very flat line, but because we have a large number of respondents and are looking at the trend from 2015 to 2019, when we ran the statistical test, it is actually a significant decrease. Same with social connectedness. So you can see this year 83% of respondents indicated that they were satisfied or very satisfied with the social connectedness of their child and their family. And that is a significant downward trend from 2015. Participation and appropriateness of care have been pretty steady. Access has trended significantly downward in the last 5 years to 70% of respondents indicating satisfaction this year, or last year, sorry. Daily functioning has actually increased significantly over the last 5 years. So you can see that's the green line there. It started out about 60% of respondents indicating satisfaction with their child's daily functioning, up to 63% in 2019. And then outcomes, consistently toward the bottom of the list there, has remained pretty steady. Next slide, please. So one of the added questions, we asked caregivers what they expected to happen through the course of their child's treatment and what actually happened through the course of their child's treatment. So you can see in this figure here, the dark blue bars are the percent of respondents who said that they expected that outcome. So along the bottom, you can see what the outcomes are. Starting on the left, become happier, become less anxious or fearful, become more respectful or responsible, and on through. So the percent of respondents that said they expected that for their child as a result of their course of treatment, the light blue bar next to it is the percent who said that they actually realized that result, or the child realized that is through the course of their treatment. So in the middle there, you can see 69% of caregivers expected their child to feel better about himself or herself through their time in treatment. And 48% said that their child actually did feel better about himself or herself as a result of treatment. 65% on the second one in from the left there, 65% expected their child to become less anxious or fearful. 45% of those said that their child really did become less anxious or fearful as a result. And so you can see some of the other areas there. Doing better in school or work, becoming happier, getting along better with family. These are some of the most common expectations of caregivers for their child's time in treatment. The smaller bars on the right there were less frequent expectations, which I think is an indication of the needs that the children were coming to treatment with. So expectations around stopping or reducing use of drugs or alcohol, hurting others, hurting himself or herself, and starting or continuing a program of recovery. You can also see that the percent that realized that expectation is closer to the percent who had that expectation for their treatment in those items. We've also seen a significant, oh, not quite yet, thank you. A significant downward trend among most domains related to expectation of treatment, as well as the achieved results. So when we look back 5 years, there are fewer caregivers that are indicating that they expect these things as a course of treatment. And because the survey questions don't allow us to ask follow-up questions of respondents, we're not sure why that is. Next slide, please. So other interesting results from this caregiver survey. Regarding school, we found that respondents whose child's attendance at school has improved or stayed the same has trended significantly upward in the last 5 years, meaning more respondents are indicating that their child's attendance has improved or stayed the same as a result of the treatment they received. Looking at law enforcement, the percent of respondents whose child had been arrested before starting treatment has trended significantly upward. So we're seeing more law enforcement involvement before treatment, as has the percent of respondents whose child has been arrested after starting treatment. So both trending upward. So both before and during the course of treatment, significantly more caregivers are responding law enforcement involvement with their child. Questions around alcohol and drugs. We've found the percent of respondents whose child's alcohol or drug treatment provided what they needed has trended significantly upward since 2015. Next slide, please. So because the caregivers of youth age 14 to 17 also received the survey as well as their youth, we were able to analyze pairs of respondents. So comparing the youth's response to survey questions to their caregivers' response to those survey questions. And generally what we found is the youth were more satisfied than their caregivers were. So these 3 items here, I got as much help as I needed. I helped to choose my own treatment goals, and I participate in my own treatment. The youth were much more satisfied than their caregivers were in these areas. These were the significant differences. I would say the trend was very consistent across all the items where we were able to compare the youth to their caregivers' response. And that is the end of our summary of this. And you have our contact information, but we have some time. So if any of you have questions, we'd love to discuss more.
Yes, there's 2 ways, excuse me. There's 2 ways that you can ask questions. You can either type the question into chat for Sarah and Rebecca to see, or you can simply type that you have a question, or you can raise your hand using the raise hand function for Zoom and we can unmute you. It's also a good time if you have any questions or you just want to respond to Rebecca or Sarah. I'm not seeing any questions or raised hands at the moment. Feel free to do so while I'm still speaking if you have any questions, and we'll circle back to that. Again, I wanted to let you know that we will be giving everyone a copy of the slides, a link to a recording of the video that can be shared, as well as a link to where you can find the reports. The reports include all of the data that we've shared today, as well as they have copies of both surveys. So if you're interested in seeing what the surveys look like, the type of questions that are asked, that's a great resource. We want to thank everybody that signed in and joined us today. This is a project we're all very passionate about, and we enjoy and we always love explaining our findings and doing all that's possible to help improve mental health in Oregon. Thank you all again, and unless somebody raises their hand or have any questions, I think we're probably about wrapped up here. All right, thank you, and I'll reach out to all of you via email. Have a great rest of your day.
Thank you.